This week, Kathy and I take a look at news which broke late this week about the Social Security Board, SSB, being sued by the Florida-based medical services company, the Jipa network. The big story this week, the BVI's Social Security Board, SSB, is facing legal action from one of its former international health service providers. Now, Kathy, this story broke on Friday, courtesy of Ken Silva of the BVI Beacon. And that article was written under the heading, Jipa Out and Suing NHI. And we must point out that this legal action comes at a time when the NHI is itself seeking advice on the legality of a decision that it took late last year where it suspended the benefits of some employees under the NHI program because their employers had been delinquent in handing over their contributions. But that aside, let's go back to the matter at hand. Why is it that Jipa found it necessary to take legal action against the SSB in the courts in December last year?
Well, based on what we've gathered here is that Jipa is claiming that the Social Security Board of the British Virgin Islands has breached its contract. In their claim, Jipa is suing for allegedly payments made by the Social Security Board to overseas medical providers without referring to them Jipa. They're also claiming payments of all monies found due and owing to Jipa for general damages and for the breach of the October 1, 2015 contract or agreement they had signed. They are also claiming for some amount of cost, and they're also asking for fraud and other relief as the court may deem necessary.
All right. Now, Kathy, while we weren't able to get a response from the SSB up until the broadcast of this program, the SSB's director, Antoinette Skelton, spoke with Ken Silva of the BVI Beacon and responded to Jipa's claim. Now, it's important to note that she told the BVI Beacon that the access of residents in the BVI to overseas healthcare will not be affected by this process or legal action, and that the contract with the Jipa, which began in 2015, came to an end on January 15 of this year. No information was provided as to whether or not there is any connection at all between the ending of this contract and the filing of the legal action by Jipa in the BVI's High Court on December 8 of last year.
Okay, but based on what we understand from the publication in the BVI Beacon newspaper is that the Social Security Board is saying the contrary to what Jipa is claiming, because what the Social Security Board is saying that there has been no such direct referrals ever made by the board for patients. But what she went on also to tell the Beacon is that they are now clearing claims directly through overseas hospitals instead of communicating through the Jipa network. She's also saying that while NHI initially mandated a 20% payment for in-network overseas providers and a 40% for co-payments for out-of-network overseas provider, Ms. Kelton said that now all patients who are approved for treatment will be charged only a 20% co-payment, and that I think is
a good thing. Definitely, that flat rate is definitely a good thing. Now, Kathy, let's go back a little bit and take a look at the SSB Jipa engagement, which began in 2015 after what the government said at the time was a non-traditional tender process. Now, Jipa is based in Florida, and what it says it does is provide access to a network of healthcare professionals and services overseas, and is then paid for its administrative cost and a percentage of pre-packaged services. But before we go any further, let's take a look at what the government officials said in 2015 about this contract with Jipa.
They looked at different options, and based on the analysis, the Jipa network option was the better option. If it was tendered in a traditional sense, like, no,
There is no upfront cost. The way the contract works is that when Jipa works for us, and the saving that we realize, because like he said, it's expensive, so the saving we realize that a percentage of that.
The savings in the United States are larger because the cost is higher. The savings, so you could achieve savings somewhere between, I'll say 30 and 60% of the bill charges when you offer care, and this is called a managed care type of system. In the Latin American and the Caribbean, the savings are less because the price of healthcare on the top side is less. So you'll see order of 20 to 40% savings.
So there you have it, Kathy. That's how Jipa was engaged. But you were also there when that press conference took place. What did Jipa themselves have to say?
Okay, the Chief Executive Officer of JPA, that's Dr. Kester Ned, during that contract signing ceremony, stated that persons registered by the National Health Insurance would have been provided with a card to access the integrated network comprising physicians, hospitals, diagnostic and treatment centers, ancillary healthcare providers, as well as pharmacies, medical equipment, and transportation companies. He also said that it was more cost effective for NHI contributors to utilize JPA rather than going searching for healthcare providers by themselves or individually.
All right. Well, for now, there is not much more that we can say about this matter, as it's a legal matter that's in the court. But we do look forward to seeing if the SSB, holds any press briefing regarding this issue or provides any information at all to the public and resolves it, hopefully, to the mutual benefit of all parties involved. That's it for the big story this week. On behalf of Kathy, see you right here on JTV Channel 55 next week.